specialty clinics to their, regular veterinarian, they might have spent upwards of $7,000 or $10,000, and then they say, "Well, I can't afford to come and see you." And it breaks my heart because I can't work for free either any more than they could.
Yeah.
But I understand all the damage that's been done, and and how much money they have spent. It's been an expensive diagnostic tests like MRIs and things like that. There are certain instances where some of the diagnostic testing that has been done, the tens of thousands of dollars or thousands of dollars, may not necessarily be necessary when you're working with a homeopath. And that's something to think about. It doesn't mean it's never necessary or we never recommend it, but it's always good to find a homeopath first before you embark on those incredibly expensive tests, unless they are life-saving measures at the time. If you need to immediately because the life-saving measure, don't delay that. Do what you need to do. But seeking out a homeopathic veterinarian I graduated from the University of Florida in 1991 with a DVM or a Doctor of Veterinary Medicine degree. A lot of people call me up and say, "Oh, are you actually a vet?" Oh, no, actually, I really am a vet. And I just went on to learn some additional holistic modalities. My experience of all the modalities that I've come in contact with is that homeopathic medicine treats the most deeply and seems to restore better than any other treatment modality. And I also am trained in traditional Chinese medicine and acupuncture, and I do use that. But I would have to say, first and foremost, that the majority of the cases that I work with, I do treat homeopathically first and foremost. And often that's all I need, along with improving diet, maybe making some nutritional or some nutraceutical recommendations, at least as a. But try to seek out somebody, and your integrative practice, I think we spoke about in our podcast together. They are not bad practices, but they are not homeopathic practices, and their brain set is allopathic. They are offering some holistic modalities. And I think it's incredibly important to make that distinction, because you will get a lot of the same as you get with your allopathic veterinarian, just with some extra holistic, in the mix. And it's sort of like driving with the brakes on. It doesn't really make sense. And so if we are considering acupuncture or traditional Chinese medicine, but you're still using steroids and Cytopoint, you're driving with the brakes on, and you are not working with a truly holistic or homeopathic veterinarian. So I encourage you to check that out and try to find somebody who is truly more holistic or takes an entirely holistic approach.
But you can have, just to clarify for everyone, you can have a holistic veterinarian that's not homeopathic, but you can't have a homeopathic vet that's not holistic, correct?
I would say that's not likely. There are some homeopathic veterinarians that are sort of on staff at, a practice, maybe as they're getting started. I can tell you from experience and also from knowing some of my colleagues that it's incredibly frustrating, because you're kind of in there. Well, when I used to do relief work, I used to call it prostituting myself, because I had to shut off that knowledge and understand all the damage that was being done about vaccines being pushed, and all of the chemicals and the drugs and the non-curative treatments, etc. And I had to turn that part of me off when I early on in my practice, when I was trying to build my completely holistic practice. So there are some homeopathic veterinarians that are struggling in allopathic practices. They're not generally fully supported. They're not generally referred a lot of cases. And I am sure that there are exceptions. A homeopathic veterinarian usually is going to be the most holistic veterinarian you're going to. If you're working with with a veterinarian that does traditional Chinese medicine and acupuncture, their hearts may be in the right place. That type of medicine focus or understanding is a little allopathic thinking. In Chinese herbs, we're going to use herbs that stop diarrhea. We're going to use herbs that are anti-diarrhea, itching, anti-inflammation, whereas in homeopathy, like with like. So it's a very different thing, whereas in allopathic drug medicine, we're using anti-diarrhea to stop diarrhea. We're using to stop vomiting, where homeopathy is really, really different. So it's easier for puncture and traditional Chinese medicine veterinarian to get along with an allopathic vet practice than it would be for a homeopathic veterinarian, because we're treating like with like and create, and they are treating anti symptom, and we're treating the symptoms to alleviate the symptoms and curatively and in a balanced and gentle way.
I'll have to add that to my recommendations when people ask me all the time, well, how do you find a good holistic veterinarian? And I had to stop telling people just to find their holistic veterinarians, because I have so many in this area where I am in Southern California of veterinarians who say they're holistic because they do acupuncture and only acupuncture, but they'll still feed poor diets. And so they're not in my definition of holistic, meaning everything, which would encompass diet and many other things. So maybe that's a really good point you make, is that a homeopathic veterinarian would probably be your most holistic veterinarian. And
that's absolutely correct. And so confusing for people, because they will say, well, I have a homeopathic or holistic veterinarian close to me, and it's the integrated practices are a little bit of a fake holistic. So there are some holistic modalities, and it doesn't mean they're bad vets, but you get a full sense that, and then the next thing you know, you're going out the door with antibiotics, maybe a nutraceutical, maybe a Chinese herb, and maybe you had an acupuncture treatment, and here's your antibiotics for the UTI. So why don't they use them? And that, except to tell you that when you're working with an integrated practice, mentality is still completely allopathic. So the first place they want to go is, well, I better use antibiotics. I'm not really going to trust my herbs. And that isn't and it's not a holistic practice. It's an integrative practice. It's just an allopathic practice that offers some holistic modalities. It's a completely different beast. And I think so that people don't get misled into feeling that way, that they're going to, oh, I'm going to a holistic practice. And then I look at the records and there's antibiotics for this and antibiotics for that. And I said, well, this isn't a holistic practice. They're using antibiotics. And I can tell you, since I've been practicing homeopathic medicine since 1995, that I could count on one hand or less how many times I ever considered or ever used antibiotics. I'm not even sure I can think of a time. And that's pretty, and I treat everything from mild conditions, acute conditions, to the worst of conditions, the death and nearly dying, advanced cancers, etc. And, I'm not saying they all survive and they all, but I can't think of a circumstance where I thought antibiotics were indicated in a single one.
It's amazing. People are shocked. People are shocked. I have one veterinarian here in the Southern California area, but she's pretty far from us. She's like an hour and a half from us, and she doesn't use antibiotics either. I don't know if you've ever heard of her. Her name's Dr. Katie Kangas, but the antibiotics are given like candy, and they just are handed out like there's no big deal. And I just recently had to take a boarding dog in because, when they're not my dogs, I have to be very diligent and careful, and I couldn't get a hold of the owner. So I took the dog into a holistic veterinarian who couldn't find anything wrong with the dog, but gave metronidazole. So, it really, exactly. It's not a holistic.
It's not a holistic.
Right. Exactly. That's the point.
Right.
I used to tell people, if they're selling flea and tick medication, they're not holistic. I don't care what the sign says on their door. In my definition, if you're selling something that toxic to prevent something that won't kill your animal, they're not holistic. There's other alternatives that will work, and they don't even offer those. And then they say they're holistic. It drives me absolutely crazy. It bothers me.
Well, I encourage people if they're searching a holistic veterinarian, go to the website, and like you said, they're pushing flea and tick medication, National Dental Month, yes, we do dental cleanings, and we work on skin allergies and do allergy testing, and it's not a holistic veterinarian. I mean, you're going to an allopathic veterinarian that may offer some natural alternatives on top of the allopathic treatment that they are providing, and that's not a holistic integrative practice. And they're not bad vets, but you are not getting holistic.
but we've got some questions coming through. I promise, guys, I'm going to get to them. But it's dangerous because when a holistic veterinarian says they're holistic and uses non-holistic stuff and it doesn't work, then it's people are going around saying, "Oh my God, I'm so sorry, guys," and people are going around saying that holistic medication doesn't work. It's a big old bunch of whatever, and it's because they're not actually. Oh God, this is probably the worst disruptive I've ever had. But so I apologize. My husband
I think this is the best.
the bottle.
It gives holistic medicine, the true holistic veterinarians, you know, a bad name, so to speak. Because I have a lot of people that come to me, maybe a partially holistic veterinarian is using combination homeopathic remedies like Dr. Good Pet or I forget what it is. Anyway, there's a bunch of them out there.
Yeah.
And well, I used homeopathy and it didn't work. Well, that's not homeopathic. You can't put a dozen homeopathic medicines in a bottle, shake it all up, and call that homeopathic medicine. And while it's not all natural medicine means that we are necessarily using it in a curative manner. So it's really important to work with somebody who truly understands the trade, because that's not homeopathy. And to say, well, that didn't work. Well, I'm sure it didn't work because usually it doesn't. Or if it works in the short term, in the long term, it's not going to. And so then what we end up with is people thinking, well, I tried homeopathy, I tried everything. Well, I don't think they have. Probably they haven't. And I think it's disingenuous to portray yourself as a holistic veterinarian, perfectly willing to reach the shelf for antibiotics and steroids, antibiotic eye creams and steroid creams, and ear preparations with steroids, etc. in them. That's disingenuous. It's not holistic, and there are alternatives. Now, sometimes if we have eye ulcers, that might be a time I could think that may be perfectly okay using an antibiotic eye drop for an eye, for example. I do use alternative things, but it depends on the severity of it. So I think if you go to a truly holistic homeopathic veterinarian, we're going to talk to you in real terms. If there is any indication that drug medication may be needed, it's going to come as a surprise. So if it's not a surprise, you probably aren't with a holistic veterinarian. So like I said, with a deep corneal ulcer, something like that, I may be perfectly fine with antibiotic eye drops.
All right, let's get to some of these questions. Now you guys know our take on all of this stuff. Let's get to these questions. So Marcia wants to know, she says, I would like to ask you if your dog has been given an allergy test and it comes back with not only food allergies, but outside allergies. Are these dogs excluded from vaccines as their immune system is compromised?
Well, consider, I can't say all, but a majority of allergies, dogs or cats, is most likely brought on by vaccinating or over vaccinating and poor diet, combination of both. Because of that, I would say that, in my strong opinion, it would be bad medicine to be vaccinated that has allergies, period. Unless the allergies are completely resolved. And the only vaccination that is required by law in almost every single state in the United States, and I believe it's every single, is the. And the other vaccinations are not indicated for adult dogs and cats and should not be used. So once you're done with your puppy or kittenhood vaccine. So yes, absolutely, a veterinarian vaccinating a dog that has a history of allergies. And I'd like to test, while they're interesting, understand that the immune system is complicated and it's not all about one side. We have humoral immunity and cellular immunity, and it's a complex topic, but suffice to say that the allergy testing is only going to test one part of the allergy response. My experience over the years has been that usually allergy testing is not very accurate. And even if you think it is, you could retest in 6 months. Completely different set of allergens, outdoor food, etc. So it's up to you if you want to follow any protocols with regard to that, but I don't tend to pay any, in my practice, I pay little attention to allergy tests if they've been done, because I do ask for all the doctor notes so that I can see what's been done, what given, what tests have been done, et cetera. And I pay little attention to the allergy tests. The food allergy testing, I might pay a little more attention to, and maybe try to avoid the foods that they appear possibly to be hotly allergic to. The rest of the outdoor allergens, what are you going to do? Stop your pet from breathing? I mean, it just, and to get the ridiculous. You just aren't really, it's an attempt to get to a little bit more benign treatment for an incurable disease in allopathic medicine. Allergies are completely curable, not in every case, but a lot of allopathic medicine. But I know now in allopathic medicine, they're admitting that allergies is incurable in allopathic medicine.
You think that the allergy test is considered acceptable by standard practice? Would it be an acceptable test to be able to get a note from your veterinarian that they are waived from the rabies vaccine?
In my opinion, and you have to go state by state. There are many states in the United States that will allow an exemption letter by a licensed veterinarian who feels that the pet's medical condition is sufficient that it would be injurious or dangerous for the pet to receive rabies vaccination. And those encourage people to have a rabies blood titer test done. I think it's a responsible thing to do. It is I recommend going through Dr. Jean Dodd's lab at Homeopathic. It's reasonable. You can fill out the form yourself. You can present it to your veterinarian. They might not be very happy with you. You can prepay for it. You can even send the sample once your vet is directly to the lab yourself. Just please be fair and understand that it would be reasonable for the veterinarian to charge for a blood drawing fee and a handling fee, that kind of thing. So be fair in that. They're going to, do the courtesy of drawing the blood sample, giving it to you, or even submitting it. But I use that even though all of the rabies titers go to Kansas State University. They're the only lab that runs the rabies. The official letter we get from Dr. Jean Dodd's laboratory at Homeopathic. It looks official, it's professional, and I feel that produces a very reasonable and a very responsible reaction to deciding not to vaccinate. I really don't encourage anybody to go thumping around and screaming, I hate vaccinations and I refuse to get vaccinations. And sure, they're harmful. But if you have a medical reason not to give the vaccinations, be responsible, get a titer done, know that your pet is protected. And yes, it does confer protection. It has been shown through field with Dr. Dodds and Dr. Ron Schultz, for example. So this does, again, avoid all the other vaccinations and avoid rabies vaccine if you can. And if you can't, check with your state and see if they will allow an exemption letter, and then find a vet that will do it for you, write one for you. You don't need the allergy test to get an exemption letter. If your pet has a history of being seen by the veterinarian, in my opinion, that should be sufficient.
Do I live in a zoo?
Hey, sure. I think that's just as strong as maybe repeated visits with your veterinarian for the same complaint.
Yeah. Sorry about that, guys. My husband is finally home so the kitties can get their food and my dog can get his attention. And, it's just 10 years. And every time he walks in the house, the whole house has to go crazy. Okay, so Nilsa has a question, and she says, my dog has pancreatitis and won't stop vomiting despite being given Cerenia, and she says she's miserable. I'm going to give you a little backstory just because I know her dog did go into the emergency room, was spent, I believe, Nilsa, you can write a question, I think a night in there, was diagnosed with pancreatitis. They sent her older dog home, it's a little Chihuahua, telling her to do a bland diet. So to the best of my knowledge, she's been doing some little bit of turkey, like ground up turkey, and cooking it up a little bit. But she says she's still miserable and she's still vomiting. And I don't know if you have any suggestions, or maybe she needs to go back to the vet. I don't know.
Strongly advise finding a homeopathic veterinarian. You can go to the Academy of Veterinary Homeopathy website, and it's theavh.org. And I'm sure Carrie could provide that for you. And
Yeah.
expect to consult or do some driving to go and see a homeopathic veterinarian. There's not enough of us out there, unfortunately. It's very difficult to curatively treat pancreatitis with allopathic medicine. Uh, Generally being successful. A bland diet is definitely a good idea. And then you could use a gentle herb called slippery elm bark. That is and I recommend the organic powder. You can find that online, even on Amazon. And you mix it with warm water to make a slimy pudding consistency. And then that could be given dosed. If you have a Chihuahua, then a quarter of a teaspoon of a slimy consistency mixture 3 or 4 times a day by mouth, away from food. Now, again, I can't really give medical advice because I haven't worked the case up. That's a gentle suggestion you could do. Your dog is going to need more than just land diet and more than the Serenia. It's obviously not working anyway, so your dog's disease is refractory to the allopathic treatment, and more drugs is not going to make it better. So I would strongly advise finding a homeopathic medicine. And then in the meantime, unfortunately, you're going to have to follow the recommendations of your local veterinarian, and hopefully it won't turn out even worse. I mean, I don't know, but it could. So I would
Yeah.
try to get on it and find a homeopathic veterinarian as quickly as you can.
So Nilsa, I have some slippery elm that we can get Minky on, but as far as a homeopathic veterinarian, there really aren't any here in Orange County that I have been able to find, so I won't be able to give you those other than us doing, consultations like that kind of thing with Dr. Cannizzaro and getting the chart in there and doing stuff like that. We're kind of limited here in Orange County as far as the homeopathic veterinarian. So we'll have to kind of work together. And
willing to do a phone consultation. I do phone consultations. Then you can work with a homeopathic vet. Otherwise, you might have to do a bit of driving.
Yeah.
I mean, you might have to go outside of Orange County. If you go to the avh.org website, you may or may not find one, even within reach. But, you could start by looking there. And that's something you could Google and go online right away and do. Otherwise, get in touch with Carrie, and she may be able to help you further to locate someone, or myself, whatever you decide to do.
It's difficult. And, Minky's an older dog and starting to have, and she's had him on a really great diet for a while, but he's really getting up there in age. And I think this is his first bout of it. So now we just have to work backwards from there and get him back on track. So,
well, the difficult thing is that a lot of people think that good diet alone is going to be sufficient to heal everything. Well, as long as I keep my pet on a really good diet, then I'm never going to have a problem. Even like us, if we're eating well and we're exercising and trying to manage our stress, life happens and we have ailments that show up. The question is, what are you going to do about the ailment? What are you going to do about that symptom? Are you going to treat homeopathically, or are you going to treat allopathically? And if you're going to choose to treat homeopathically and you set yourself up with a homeopathic veterinarian, then you have that person at your fingertips so that when life events happen or suddenly pancreatitis rears its head and we make sure it's not cancer and all that. I mean, I would often recommend to make sure we have proper workup, like maybe abdominal ultrasound, make sure there's no masses, no other causative reasons, rule out the big things, the concerning things. And then, if everything looks A-OK there, it doesn't mean we can't treat cancer. Prognostically, it's a good idea to know. So I'm a homeopath, support doing diagnostic testing to have a prognostic idea and to have both an allopathic idea about what's going on. And then I can take a homeopathic approach for what's going on and how to treat. So don't be afraid to have diagnostic tests done. And I always tell my clients, if you go to the emergency clinic, let them do some testing. If the pet is sick enough to go to the emergency room, then don't go there and tie their hands and say, nope, I'm not doing any testing. I'm scared that my pet's ill, but I'm not going to do any testing. It makes no sense. And then what you're making them do is treat your dog, not knowing what's wrong and using medications that could be potentially dangerous or life-threatening. So at least if we know we have pancreatitis, we know we're not going to give your dog a steroid injection, which could make pancreatitis worse. Of course, I wouldn't treat like that, but you know what I mean, at an emergency clinic. So let them do reasonable tests if it sounds reasonable to you. to gain an idea of what's going on, what's the severity, does my pet need to be hospitalized, can we treat at home with supportive care, and then what care. And again, find a homeopathic veterinarian. Do your best.
I am so glad that you said reasonable testing. And before I get into some more of these questions, I just want to put this out there and hear your thoughts on it. But I actually get calls from my clients, which I love and appreciate, and thank you guys for trusting me. While they're in the veterinarian's office, sometimes in the emergency room, and they'll say, the vet wants to test all these things right now. I'm supposed to sign off on all these things. And I usually tell them, why don't you start with one and let's kind of work from there? Because if you can run a blood test or if you can run an ultrasound, and I'm just curious what your thought is, to sign off on 12 tests when your dog's just vomiting seems overkill to me. And I'm not saying not to test, but I think it's better to work down from that, not just, okay, I'm going to do the x-rays, the MRI, the ultrasound. And I see that a lot here at the emergency clinics.
Well, I want to say a couple things to that because I worked in emergency medicine for some time. Latter stages of working in emergency medicine, I started to offer, because I worked with a great owner of an emergency clinic that didn't care if I used homeopathy. She said, as long as you practice good medicine, if you want to offer homeopathy, I don't care. Just do well by the pets. And I said, got it. So, and I would ask the client's permission. But what I want to say about that is a couple of things. At the emergency room, it's high pressure, a lot of people, we're triaging. There's emergencies. We're trying to figure out who's the most urgent. I'm going to tell you, because I worked emergency, that it's really difficult to do one test at a time. And the reason being is that every time I do a test as an emergency vet, which I don't do that anymore, although, I have emergencies in my practice, I just handle it homeopathically. Every time I do a test, I've got to come back and report that test to the client and then say, can we do the next test? It takes too much time. So what I'd like you to think about is look through that list and talk to the veterinarian about what is most reasonable to tackle first. So would it make sense to do the x-rays and the blood work first to make sure I don't have a foreign body obstruction, or I don't have liver disease, kidney disease, pancreatitis, because I have my pet's vomiting? That would be reasonable. Do you need an MRI? Probably not. Do you need an ultrasound right away for that? Not unless they're feeling something really bizarre in the abdomen. And I want to say this that's incredibly frustrating and important to bring up here. I don't know that there's much that our listeners can do about it. Veterinarians is becoming a lot like human medicine. What that means is veterinarians have forgotten to look, smell, feel, and use our brains as puzzle decoders. When I get a case in, and I don't do x-ray anymore or anything like that, I refer out if it's necessary. Smell the breath, look in the mouth. Maybe there's a foreign body stuck in there. Why do you have to x-ray up and down the entire dog because you didn't bother to look in the mouth? We as veterinarians need to go back to doing what we were taught to do, at least for me anyway, in the early 90s and late 80s when I was in vet school. We need to look at the patient. We need to think about what the client's telling us, the clinical history, do a full physical examination, and not leap immediately into $1 billion of tests. Yeah. We need to be doing this. I can't tell you how many cases that are ridiculous. Even my own horse was sick this was several months ago. It turned out to be a bloody urinary tract problem. Now, who would know in a horse? They almost never have it. And I did a whole bunch of blood tests. I couldn't figure out what was wrong. But because I paid attention and noticed that he urinated 2 times in a row, and the second time he strained and a little discolored urine came out, I said, aha, I think I've got it. If you don't pay attention, you could go on such a rabbit hole of thousands and thousands and thousands of dollars at a specialist or even your regular day veterinary practice. I don't know how to help you with that. What I want to do is to help educate people to pay attention to vital signs of their own pet. What's breathing? Are you able to feel the heart if you put your hand on the chest? Can you look in the mouth, and what do the gums normally look like? Are they nice and pink? Are you used to taking a rectal temperature? See what your dog's temperature is. I'm not asking you to be vets, but my clients, if I'm doing an emergency phone consultation, I'm going to ask them to look at all those things. Push on the belly. Is it hard? Is it painful? you don't have to be a vet, but it will help you understand the severity or the urgency of maybe needing. The gums are white, black. They're very painful. They're listless. They need to go to the ER. At what they're proposing and ask questions of them, and then approve to the best of your ability what makes sense to you within reason, without saying, I'll do one test at a time, just one test at a time. What That's a lot to ask of an emergency clinic. And I can't help it if they're not going to do a really good, thorough physical exam and,
Yeah,
and do what I think they should be doing.
I think it's kind of a little unfortunate too, at least in Orange County. I don't know where everybody else is having the same problem, but getting your dog in to see a vet. So a lot of people are using the emergency rooms for non-emergencies, but important.
Yeah.
And so you've got these dogs going in there that aren't full-blown emergencies, and the veterinarians are coming back and saying we need to run all these tests. And I so glad that you brought that up. I've worked in veterinary hospitals before, but never an emergency room veterinary hospital. So I can see why that would be a problem, trying to, keep bringing each test back. But I do think, to your point about having a veterinarian who is looking and paying attention to the dog. I once had a client bring me a dog who had an test done for spinal problems, because every time the dog would walk, it would turn and lick its bottom very quick. It would turn and lick, turn and lick, turn and lick. And so she brought it into the vet, and the vet said, oh my gosh, we got to see if there's some kind of disc problem. And they ran all these tests. And I bet you could tell me right now what it was.
Probably an anal gland abscess.
Gland, exactly.
Right.
And it was so sad. They spent all this money and to find out it was an anal gland problem.
Yeah.
Tim,
It's hard when we go behind some of these veterinarians, because we all make mistakes and sometimes we do miss things. But a thorough physical exam is really important. And if you smell something, notice something, and often even asking clients detailed questions, well, you guys are going to give us really incredibly good information about where to look.
Yeah.
Intuitive understandings are terrific and spot on. And I think I have a gift in being able to really kind of get it, where the problem is. And that doesn't mean I'm right all the time. It absolutely doesn't.
Sure.
None of us are right all of the time. And perhaps it's because I did emergency medicine. We have to think quickly. We've got a problem. And now I really feel for clients, because we have curbside with COVID, and now you're even more separated from your pet. And there's even more pressure to run all those gazillion tests, because they have to function a little more like an emergency clinic, because they've got all these clients and it's curbside and they're trying to get them in and out and get all these tests done. And they don't want to labor through the various tests. And even in my own practice, I'll talk about the practicality of things. The new patient I saw today with her overweight dog, she said, well, how about a thyroid test? And I said, well, a good thyroid test has never been done. But there has been a poor thyroid test done, and it's come back within normal limits. And I said, let's work on let's give a homeopathic medicine first and see if this addresses the allergy issue. See if your dog gets better, and see if your dog actually begins to lose weight. And if that happens, we won't need the expensive thyroid test. And if it doesn't seem to happen, let's go ahead and do the thyroid test. And, okay. I could have logically and reasonably done the big expensive thyroid test today in her initial appointment, which is usually more expensive anyway. But I could have done that and it would have been reasonable. But what if metabolically I can help this pet with the homeopathic medicine and we don't have to do the thyroid test? And if we don't have to, fine. It's not like she hasn't had any diagnostic tests done. So she was perfectly happy with that. We can be reasonable about testing and treatment. The problem in allopathic medicine is that they don't have any cures. So to wait and isn't really going to get you anywhere. Maybe you're better off doing the thyroid test and knowing. With a homeopathic, we have some latitude, unless it's a life-threatening condition, and I treat those as well.
It's interesting. I just want to point out real quick, Marcia said she wants to thank you because she says
thank you for joining us.
She says that your website that you shared with her to help her find a homeopathic vet, she said she's had to drive 4 hours this Friday to have Gracie have the first visit. The vet answered the phone today, as they just got their electricity back on today. but she just said thank you. I guess you had given her a referral.
Oh, super.
Yeah, so that ended up working out, it sounds like, for her. And then she also asked what she currently is feeding her dog Answers. I think she said, no, I lost the question. Oh yeah, she's feeding her dog Answers, but she says, what food do you recommend? I guess
That
I
that's a
think
really difficult question. You'll note my website is currently under construction. So for anybody that's visiting it, I apologize ahead of time. And we're working hard to get that kind of back up and running better and presenting better information. Your website that I don't recommend diets. The key reason for that is because it really needs to be individual to the patient. For instance, the individual whose lovely little dog has pancreatitis, I'm not going to recommend a raw diet. So it's not that I'm against raw diet. It's just not a good idea for a dog like that. It needs, more pre-digested food. I'm almost always going to recommend whole foods, whether it's cooked or raw. And it ought to be really guided by your homeopathic veterinarian because there's no one size fits all. I'm not against Answers. I've used their product. I'm currently using but it doesn't matter. There's some good companies out there. Not all raw diets are perfectly balanced. So I do recommend variety, including a variety of home prepared foods of your own, which, again, should be guided by your homeopathic veterinarian. And I don't mean, but I don't know if certain animals have sensitivity to various things or if their digestive systems are too weak to handle foods that otherwise healthier pets could. High fat diet to a dog that has pancreatitis, or a high simple sugar diet to a dog with pancreatitis, or a diabetic with those types of foods. So it's incredibly important not to confuse people by putting out there to you or anybody else, well, this is the diet you should be feeding. So, and sometimes I will use food therapy diet based on Chinese medicine. And sometimes that's helpful as a temporary measure for animals with various ailments and need some food therapy. So that's why I don't give you a diet. If your dog is doing well on Answers for now, I would take that up with your new homeopathic veterinarian and just check and make sure that that seems compatible treatment wise going forward nutritionally. And I wish you well. I hope it's going to go really well for you, Marcia.
it's really hard because when I own a nutrition store, so I have all sorts of food in my store.
Mm-hmm.
And I used to think I only need, this is a long time ago, but I only need one or maybe two that I recommend because I believed in these, and was one of them. And as time went by, I started realizing I don't care how healthy the food is, it may not be working for X, Y, and Z dog. And
Right.
so I branched out, and I still have people come to me. I just had someone the other day who he's eating a food that I support and I like, but his dog has what I call excessive shedding. And so I mentioned to him that this might be diet related. And of course, his very first answer is, well, I'm feeding him the food you said. So,
Oops.
I know, it's fine. I always respond pretty much the same way. Well, that one's not working for him. So, or we need to go look at something else, thyroid or something else, or he needs to go look and see what else is going on because it's not normal shedding, it's excessive. And it's a
Well,
Frenchie, you'll
yeah,
like,
just bring you back. I mean, remember that diet is not everything for fixing clinical symptoms. And the diet may be perfectly fine, or there may be a minor tweak that has to happen to that diet, or the dog may need a homeopathic treatment. And I'm not going to pick on clients, but sometimes your mother-in-law or your father-in-law is slipping a milk bone, and it's not like a milk bone is going to ruin everything, but if it's something on a regular basis, and there may be treats like bones and raw hides that people aren't even really thinking about, that could have any kind of negative effect in good food, but they don't realize that rawhide bone formaldehyde. Well, that's certainly not going to be very beneficial for health. So wouldn't you think they'd be shedding a lot? So it may not be a hormonal problem. It may not, it may or may not be that the diet is balanced. It could be that the diet's not working for that pet, or it just could be that the pet really needs a good homeopathic workup and that we just need to tweak a few minor things and they can stay on the same diet. When I see a patient, if they're on a good foundation diet and they have a few symptoms, I'm unlikely to change. I see a real flaw in it. And then I'll work on tweaking, some nutraceuticals or homeopathic treatment. And if they still fail to do well with that, then I'm going to start to assume that maybe the diet isn't the best agreement for them. I don't
Yeah.
make a decision based on that.
It's hard because, people want diet to be the solution to everything and also the problem of everything. And it can't be that. And I think people know how much I study and love nutrition for animals. So a lot of times they think I'm going to give them, they'll come in with whatever ailment and say, all right, he just got diagnosed with what food do I feed?
Mhm.
Hold on.
Yeah,
I mean, obviously I'm going to always say nutrition is a foundation, but it can't be everything.
absolutely. It is a foundation, and I want the listeners to hear that, garbage in, garbage out. So if we don't of nutrition, there's little to build on. So I can treat homeopathically. Let's say somebody comes to me, let's pretend I'm a human homeopath, and they smoke. We can improve their diet, treat homeopathically. How healthy am I going to make that patient if they continue to smoke? So if you don't have a good foundation in general, or one, and I know it's maybe not very nice to think about, but what if a spouse or a family member is a smoker? Maybe that's why the dog sheds. And they're on
Yeah,
a good diet and we're doing all this other good stuff. And there's so many little things that many people don't really think about. Or what if that pet's continuing to get vaccinated? That's another common reason excessively. And so we really need to dig deeper because there may be a simple answer to that that isn't a matter of the food isn't right or it's not balanced or it doesn't agree with this pet. Now that said, I have had circumstances where a client of mine I think bought answers, and it's nothing against answers. Um, Ate it really well, and then all of a sudden her two cats started throwing it up all the time. And it wasn't just like a transition thing. I mean, it was repeated, repeated, repeated. It didn't agree with them. Simple as that. It just didn't. I don't think the food was poisonous. I don't think that they put something poisonous in it. I don't think my client mishandled the food. Like, she's an educated person. It just didn't agree with her cats. So I'm not telling you keep feeding the food if it's making your pet sick. But if
never.
there's a mild symptom, it might be something else, like some of the things I already mentioned.
Yeah. Yeah. I think, a lot of times people come to me because we are known mostly for grooming, but they just think like shedding is just, I could put a de-shedding shampoo on and it miraculously is all going to go away. And
Don't forget to wave your wand. So your anti-shedding wand and, laying of hands of no more
actually,
shedding.
because so many groomers charge all this extra money to do all this de-shedding stuff, and no one's talking about the internal aspect of it. And when I try to, I've had people where I've tried to say, oh, I would, if you really want me to help you with your dog for excessive shedding, we got to talk a lot more than me just throwing on some shampoos. But I will say some conditioners do work when the coat is really dry and it's shedding for those reasons. And so we do that. But okay, so one of the things I wanted to point out, I just read this the other day, and then I'm going to get to some more of these questions, but I wanted you guys to hear this. And it was a quote, and I apologize because I can't remember who said it, but he said, it was a doctor, and he said, you're either fighting or fueling disease. And it was just, I loved it because it is, you're either fighting it or fueling it. So if you feed a poor diet, then you're just going to fight it forever. You're just going to fight, 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 fight. So, because you're fueling it. So you have to, one or the other. That's how I think about nutrition in a lot of ways. So, and that's everything, right? It's the vaccines. We're either fighting it or fueling it. It's pretty amazing. When
I
people's
mean,
have,
that's the basic tenet of veterinary induced diseases is that, we're often fueling and adding to the original chronic disease that came into our, and we are now adding additional disease on top of that and pushing around and manipulating that chronic disease until we get to greater, bigger, and worse disease. And one of the things to consider, and I think it's an important thing to note, is to change the word side effects of drugs. And what side effects truly are, that's a very makes it all sound really nice and pretty, whether it's human medicine or veterinary medicine. Side effects are the disease the drug causes in your animal. That is what a side effect is, period. And so we can stop calling it side effects, be less polite about it, and say, well, it's the disease the drug causes. That's what it is. That's what a
Well,
side effect is.
don't you think my problem with the word side effect, although I use it because it's just a habit, but
It's a
I
habit.
think most people think that a side effect should happen immediately. So they're looking for that. They're looking for, well, how many times have you heard this? But I've been putting flea and tick stuff on him for years, and this is the first time he's had a seizure. Because they look for or I had this case, and I talk about this case a lot because it was one of my most frustrating ones. It was a dog who got the flea medication and had the seizure 24 hours later, and the vet still wanted to say it was not, and it happened twice in a row, both within 24 hours of when the dog was given it, and the vet wanted to say it's not a side effect because 24 hours had gone by. And
Wow.
I think a lot of times when we use the word side effect, in people's minds, they think it should be instantaneously. Otherwise, it's not. It doesn't happen. I don't know if that's been your experience, but it certainly has been mine.
Oh, it absolutely. And whether it has to do with vaccine reactions, I had an argument with a colleague once. It was a gentle argument. It wasn't a big argument. And my colleague said, well, I've never seen, vaccine induced disease. Well, you usually don't see vaccine induced disease. I'm sorry. I just heard something kind of, oh, it was my credit card machine. I'm like, keeping up on me. I was having an argument that said I've never seen vaccine induced disease. Remember that these are cumulative effects, and the body can take only so much assault for just so long. And that is going to vary. And I'm going to bring it back to the smoking analogy. How many times have you known people that have smoked for like 15 years and they're still jogging and swimming, or, they look kind of okay, look pretty healthy. And then you have somebody who's been smoking 5 years and boom, they have cancer. Everybody's tolerance level, same thing in animals, is going to be different. And we cannot assume that negative reactions or diseases are going to happen immediately. We have immediate effect reactions of the drugs or procedures that we do, and then we have the long-term cumulative effects. And we have to appreciate both of them. The dilemma is when you're going after a drug company is if the seizures occur 2 months after giving the medication, it doesn't mean the medication wasn't the cause. It's a little less compelling. But if you have anything that occurs within 24, 36 hours or 48 hours of a medication being given, it's kind of dead on obvious. I mean, the body is coping and trying to do the best it can, but you do not ever have to have an immediate reaction. And think about I don't know if listeners are familiar with this with cats, the known vaccine induced fibrosarcoma cancers in cats, which is a soft tissue cancer that's known to be caused by the feline leukemia vaccine and the rabies vaccination. But sometimes it doesn't show up for 10 years. But we can still test those tumors and see that it was vaccine induced. So you can't tell me, and no veterinarian can tell me, oh, there's no correlation there. That was 10 years later. We know that it is. It's a cumulative effect. And if it doesn't occur this time, or I had one cat I treated for a fibrosarcoma, hadn't even had a rabies vaccine for 10 years and the tumor showed up. Now, gratefully, I treated homeopathic to disappear, which doesn't always happen. So listeners don't get too excited, but it does happen. And in this cat, it did happen. But I quizzed her about that, and she said, no, absolutely. It's been 10 years. And the medical records I had, there was no evidence any rabies vaccine was given anytime sooner. So that really needs to be debunked. And I don't know that I would call it a side effect. It's clearly a cumulative disease of the drugs that are being used. And it could be a combination of drugs that are derailing the pet. It's like the straw that breaks the camel's back. Think of it that way.
Yeah. Going back to the sarcomas, do you think, and I'm sure you've seen these, I don't know if there's a scientific name for it, but we see this a lot in grooming where a dog will come in and he's this big hairy dog and then they have to get him shaved for whatever reason. And then we shave him and then that telltale vaccine mark on their back hip, bald, discolored, from the vaccine, and I'll find out later although they always think the groomer did it, and I'm like, we don't shave little round circles. No one has time for that, but I understand. They didn't see it before because the hair was covering. Then we cut it down short, and then that, you know what I'm talking about, that round little mark right on the hip.
Mm-hmm.
The hair never grows back, and if it does, sometimes it'll come back wiry or discolored. So, do you think, and I don't know if there's any studies on this, but that would be a precursor for that dog possibly getting cancer, because he's had a pretty severe reaction to it?
It's hard to say because reactions come in a lot of different forms. And again, the body is an incredibly, animals' bodies, humans' bodies, incredibly dynamic, always wanting to achieve balance and homeostasis and healing. And then we do things that prohibit that. So you can get vaccine damage that ends up kind of stopping at the skin level and doesn't necessarily mean it's going to go further than that. But remember, if you keep smoking or you keep vaccinating, that you can increase that possibility. And it might be somewhat independent of that specific injection, but it's a cumulative effect on the body and the body's ability to stay healthy and maintain homeostasis. So I wouldn't say, and I think it'd be really hard to try to do a study on that because you'd have to find dogs that actually had those marks and follow them for a long period of time and control their circumstances, et cetera.
Yeah.
Before I was a veterinarian, I worked in renovascular hypertension research. And so I know an awful lot about research and research studies and controls and whatnot. So I have a lot of opinions about the COVID vaccine, but we won't go there. And so it would be a tough study, but some maybe not strong enough to be able to just maintain it more at that tissue, the subcutaneous and the dermal layer, those are layers of skin, and then under the skin would be subcutaneously. They may be able to maintain it just at that level. Just like maybe cats that might manifest an abscess, which is, just a walled off infection, which, by the way, almost never needs antibiotics and almost never needs to be lanced. The body's really clever. It's going to open up and drain that almost always on its own. But, it's good to seek out a holistic homeopathic vet.
It's so interesting to me. And I have several, I want to say hundreds of dogs that have these vaccine marks on them. I can't tell you how many of my clients have gone to their veterinarians who have given them creams and ointments and allergy shots and you name it to get rid of it, and it doesn't go away. And I feel bad because then they come to me and I'm like, look, I don't know what to tell you other than that is a vaccine mark. I'm sorry your veterinarian didn't know, but that's what that is. And that's hard because then I'm fighting against what the veterinarian said. But what is also interesting to me is I have one in particular dog. This is kind of an interesting thing. Gets the rabies vaccine. This shows up about 2 months later. And then about a month later, the dog gets pancreatitis. And I'm like, all of this is all starting, I think, from that rabies vaccine. And I know that no veterinarian is going to say this, but this dog has never had pancreatitis, has always been super healthy, got that rabies vaccine, got the vaccine mark. Is there another name for it? Is there?
Not really. I can't say that I've seen an awful lot of those, but then I must confess, most of the clients that come to me, they've either already figured out that it's not a good idea to vaccinate so much. So, and some of them, a lot of them don't come to me with, well, I shouldn't really say a long history of vaccines. It depends on when I get them. I haven't seen a lot of those marks, but I have seen them before. I've also seen where the skin just rotted right off.
Yeah,
I mean, just a total necrosis, which is rotting of the skin tissue. There's absolutely no surprise that case that you're talking about could progress to pancreatitis. And we know even in allopathic medicine, so I'm not speaking just as a homeopath, that vaccines, especially if we over-vaccinate, can confuse the immune system and we can cause autoantibodies against our own tissues. So that could be against the kidneys, against your own red blood cells, against your own platelets, against your own joints, causing polyarthritises and rheumatoid arthritis diseases, the heart, liver, pancreas, and the pancreas is very sensitive. And remember also that the pancreas is connected to your digestive system. And the entire digestive tract has an enormous amount of your immune system, both for humans and animals. And when we damage that by treating with antibiotics, etc., then you could be ripe for pancreatitis. Absolutely. Because
Yeah.
if we damage the gut, if we cause a leaky gut or we cause inflammation or anything like that, then we can absolutely trigger pancreatitis. So that wouldn't be a surprise in the least, nor is it a surprise that animal could get diabetes after getting vaccinated, et cetera. Because again, we're dealing with the pancreas and insulin and I see it all the time. No, I shouldn't say all the time. I see it really, really often. And
Yeah.
vaccine damage, very sadly, is so common. I almost feel like a broken record when clients come in. And I feel really bad about it because I feel like a one trick pony. Oh, that's vaccinosis or disease of vaccines. And it isn't always that, but it's so common. And we
So
can do better. We can do better. We can just not use all those vaccines that are not necessary and vaccinate for rabies if the patient is and only utilize the longest, like the 3-year rabies vaccine. So you only have to do it every 3 years, but you still should go in every year to your homeopathic veterinarian or your local veterinarian to have a good physical exam at least once a year. I always recommend that.
So we've talked about on all of my shows, but you and I have personally talked about certain vaccines. Uh, can you just, for our listeners, give a list? Is there a list of vaccines that you wouldn't ever give a dog?
Well, why don't I make it easier? Even the AVMA and the American Animal Hospital Association have pretty much acknowledged core vaccinations. The core vaccinations are distemper in dogs, distemper, parvo, adenovirus, which is the hepatitis or the liver virus, and rabies. That's it. Those are the core vaccinations, period. In cats, it's panleukopenia, which is the distemper kind of slash parvo disease in cats, and rabies. That's it. The other vaccinations I would never recommend, and they are really not necessary. Another thing I think that would be a good place to insert here, because you asked about vaccinations, is to educate listeners, if they don't already know, that in cats, feline leukemia and feline almost exclusively a kittenhood disease. It rarely occurs in adult cats. I'm not saying it's impossible because there's no such thing as impossible, but it is rare. And a lot of people are led to believe, oh my goodness, your cat, an adult cat's going to get feline leukemia if you adopt a FIV positive cat or an FELV positive cat. Better not bring those in. Or, oh, you better get vaccinated even if your cat is an indoor cat, which is ridiculous. I mean, just ridiculous. And then parvo and distemper are puppyhood diseases and rarely, if ever, occur in adults. So really, we're distilled down to the rabies vaccination if they're healthy enough to receive it. Personally, if I had a puppy, I wouldn't even do puppyhood or kittenhood vaccinations. I would keep my pet healthy on a really healthy diet. And I would certainly not do, risky things like going to very depressed parts of town where there's a lot of not sanitary conditions, et cetera, and expose my pet to that. Nice, clean parks where people over vaccinate their pets, in most cases, should be okay. Use judgment.
Yeah.
As you're going through this, the older that the pet gets, the more competent immune system they're going to get. But a little bit of exposure to natural diseases is not necessarily a bad thing. And some animals are going to be exquisitely sensitive to those infectious diseases. And so it's important to follow the advice of your homeopath to get established with a good well program, so that you can feel competent going ahead and make sure that one way or another that you feel most comfortable with. And we're here to guide and talk to you about that so you can make a decision you feel more comfortable with, whether that's using heartworm prevention, whether that's deciding to give or not to give puppy or kittenhood vaccinations, or whether it is or isn't to give a rabies vaccination. We're here to help guide you through that. A homeopathic vet is. I'm not sure how much guidance you're going to get. Allopathically, you'll get everything.
I think that you bring up such a good, well, lots of good points, but in the guidance, I think that's where I find a veterinarian, whether they're traditional or they're holistic or they're homeopathic. I think the best veterinarians are the ones who, let's say, for example, you go to a homeopathic veterinarian who doesn't believe in heartworm medication, and you go to them, and then the owner says, the companion owner says, I really want it. Are there any other, is it all or nothing, or is there anything in between? And that's where the conversation should come in, because a homeopathic veterinarian may be able to say, okay, I understand your fear, and maybe let's do this. And maybe we find a middle ground. And I think that that is so important, because we get that a lot. It's, you go to your traditional veterinarian and it's all or nothing. You have to vaccinate for everything, or I don't want you to be patient. And sometimes I see that with some homeopathic vets who just say it's my way or the highway, and there's no middle ground. And I know, I just, from talking to you, you're not that person. And
No.
it's about the animal, and you're not doing any good, right, if you're all or nothing.
I mean, I am a very strong believer in less is better. But that said, I live in Florida. I mean, it's a pretty endemic area for heartworm.
Yep.
I would say in my practice that there might be 40% of my clients that choose to use heartworm prevention. And I tell them they can safely use it, well, as safely as a drug is. You can safely use it every other month for protection. And the
Yeah.
drug companies kind of admit that. I've pressed them even to admit that probably the monthly preventatives are good for up to 3 months. But generally speaking, if people want to use heartworm prevention, I'll tell them use it every other month, so at least less is better. And
Right.
use a medication that has the fewest chemicals in it. In other words, they have those big Mac Daddy ones, and they'll kill fleas and ticks and ear mites and all that. I don't recommend any of the topical ones.
Yeah.
And just stay basic: Interceptor, Heart, Ivor Heart. Do your best to stay away from as much of the additional chemicals as possible. In my practice, I tell my clients, and I feel strongly about this, that advocate in their pet's welfare. And I have strong beliefs about things. I have clients that decided that they wanted to add a medication, close to end of life, or the pet's really ill. And I might know that idea and that may accelerate the passing of that pet. Here to be an advocate and a support and an educator. And I think it's incredibly important for you to bring my expertise to the table. But my expertise doesn't mean that I know it all and that I know that all of what's best. And some clients need some things, perhaps. Some clients are so frightened of heartworm, for example, even though I might say as a homeopath that if the pet is optimally healthy, they're less likely to get heartworm disease. It doesn't mean that there might not be somebody who's really frightened about that.
Yeah.
And should that be the case and they want to use preventative, if we don't have that degree, then I just don't think we're doing our service. And I can have an opinion about something. It doesn't mean I'm always right. And
Right.
it also doesn't mean that that it was the greatest of ideas to do. But if a client needs something, I'm going to support them the best way we can. And if we find that that pet has a problem with the preventative, some of them get sick after getting it. And after a couple of treatments of it, they'll say, oh, well, I'm really making this connection. I don't want to use it anymore. And
Yeah.
that doesn't mean every pet gets sick from it. But if we all stay open minded, then we can go down a path together where we might recognize there's a problem. It seems like it's going okay. Well, it's okay. We'll just do the best we can.
Yeah.
And
Yeah.
if they, sometimes, and they come in sheepishly, oh, I used one of those, those flea and tick poisons that I know you freak out about. I don't fire them. We're all human. So they freaked out about a flea infestation in their house and they used the poison ones. Do I think it's a good idea? No, I don't think it's a good idea. Okay, so they did it. So what? If nothing really bad occurred from it, we'll do the best we can. And
Oh
it's
my
okay.
God.
We'll just go forward. If our clients are afraid to talk to us about what their concerns and fears are, then we can work as a partnership in well care. Then
Yeah.
all we're doing is tiptoeing around each other, not telling each other truths. And I don't think that that really makes them feel good about their experience or even good about their animal. They're going to sit there living in guilt. Don't live
Yeah.
in guilt. So what? You gave medication. So what? Okay,
Amen.
forget it.
People come to me all the time and say, Carrie, you're going to be so mad at me. I'm like, just stop right there. I'm not mad at you. Let's
Right.
talk about it. Let me see if I can help you. Oh, okay. You got 6 large German shepherds. I get it. You're going to feed kibble. How about we do a little egg in there somewhere, or we do this, or we do that, or do this. I'm not going to be the
Or
all or nothing.
so they're steaming broccoli. Maybe they could add some broccoli to the kibble, or and I
I
have
wrote
clients who
a
sometimes
called
they just don't have a budget, and we'll just do the best we can with the top kibble. There isn't really such a thing, but you know what I mean. We'll do the best we can, and you know what? If you're cooking and you're cooking some rice or quinoa or millet, or add some of that to the food. How about some beans or lentils or egg, or just supplement the food. If
yeah.
we make clients feel bad about what they're doing, and again, I don't want to make like excuses where people are like, oh, goody, I can feel, I could feed kibble.
Oh
Do
yeah, I'm
it,
not.
do what do the best that you can. Try to strive for the optimal. And if you fall short because you're caretaking for your mother and your father who are dying, and you don't home prepared meals, and gosh darn it, you bought some organic canned food, or had to feed a little bit of the best quality kibble you could, and then you throw in some whole food. I mean, we have to stop beating ourselves up. Life is life, and we're going to have some bumps in the road. I ate a chocolate wafer today, and it's not on my diet. Oh my gosh. So
No, I know.
it's so what? So what? I mean, it was organic. I don't know if that counts, but
It
it was
matters.
organic. Yeah,
Matters.
man.
That's what I would say.
So, but that's
My
not something we customarily eat. And I'm not saying you should go out and do that kind of thing, but we have to have a dynamic relationship together and do the best that we can. And not necessarily, I have clients come in all mad at me because I did this and this and this. And I is where people are scared because they're allopathic horse vet. I might not be close local to them. May have given a bunch of drugs. I have a case like that going on right now. And she's like, oh, you're going to be so mad at me. I let the vet give all these drugs. And I said, don't worry about it. Let's just the case, prescribe a homeopathic medicine. And guess what? Because of the horse's condition, and it doesn't matter that you don't know the drugs, I told her, I want you to use a really low dose of Banamine, which is a non-steroidal anti-inflammatory. This horse couldn't get up on his own. So this is a life-threatening situation. I said, no big deal. We're going to use the drug. We're going to make sure the homeopathic medicine is working. If it appears to be working and it's a good remedy, then we can start taking that non-steroidal anti-inflammatory away. This is about working with a homeopathic veterinarian. Do I say don't use any of that stuff? That's lovely. But this is a 1,800 pound, or actually I think he's 13 or 1,400 pound horse. They can't haul him up off the ground, and he'll die if he can't get up on his own, and they can't get him up. They can't live lying down, period, for a long period of time. So what are you going to do? And if that drug temporarily gives me enough symptoms to work with homeopathically, but helps this horse progress and not suffer as much and be able to get up and not kill the client's back and body, it's a win-win.
yeah.
And especially if we can save the horse's life, which still remains to be seen. I hope so. I didn't get to read the email tonight, but I did see the header on the email that that improved. Looking forward to being able to read that email. I didn't have time before the podcast. So it sounds like the remedy is working. Maybe we'll be able to get off the non-steroidal anti-inflammatory. So work with your homeopath, work with somebody who is malleable, and that goes for your allopathic veterinarian. You have a gift if you have an allopathic veterinarian, which is a traditional vet, who will listen to you and will make some exceptions. Oh, okay, if you're not comfortable with vaccinations, and I see your pet has allergies, and okay, we'll not vaccinate. I'm okay with that. You have a gift in that individual too. So appreciate the things that you do have, and if you don't have an allopathic vet that's like that, move on. Just move on. If it's an all or nothing, move on.
Yeah, I've had to be blunt about that too with some of my clients. I'm sorry. I had to tell someone just recently, you have to find a different vet. I could even go down that road of, and I love a lot of veterinarians. I think that but there are some who I just have to say, I'm sorry, that's not even the right thing. That wasn't the right thing to do. So I'm going to ask you one more question, and then we're going to let you go because we way past our time. But Marcia,
I hope we haven't spoken over people's questions, because that
no,
was
I think we've got questions quite well, unless there's some that I haven't seen yet. The ones that I have that were brought to my attention, I have here. So if I didn't get everybody's, I apologize. But Marsha also wants to know, and I can comment on this if you can't, because I use this product. She wants to know what your thoughts are about the Adored Beast company. Have you used any of their products or know anything about them?
I haven't. No, I'm not familiar with them, so I just don't know. Just
Okay.
know that most of the time, not Carrie's nutrition because it's incredibly important. Um, Usually, you can go on the internet and find this is going to cure that and that's going to cure this, and it's rare you're going to find a supplement that's just going to cure whatever ails your pet. It doesn't mean it might not help some or it won't be harmful, or I still just encourage you to, I'm not taking anything away from that company because honestly,
Yeah, no,
I don't know that company at all.
right.
Kimberly probably does. And, find a homeopathic guide you through. And if you don't have that, work with somebody like Carrie who can give you some direction, at least to get you started. And it doesn't mean that company or that supplement or supplements wouldn't be nice or helpful. But if your dog is persistently vomiting with pancreatitis, we need to pretty quickly. I mean, it's one thing if they have pancreatitis, they're a little uncomfortable, appetite's a little bit off. The key thing I tell clients constitutes emergencies. If your pet is lethargic, can't hold food or water down, they don't greet you at the door. They're like a doormat on the floor, not very responsive, can hardly breathe, struggling to breathe, or bloated, severely painful. Those are medical emergencies, and they need tending to right away. I mean, a lot of diseases in the emergency room, we often see acute flare ups of chronic disease. They're not true acute diseases, they're the chronic disease, and they have this explosive flare up. Whether that's happening for your dog, Marcia, I can't say, but it's not a state that we want to see your dog stay in if your dog is consistently vomiting. Your dog is happy, wagging their tail, bouncy, playful, that's less serious than if your dog is really feeling unwell, painful, and not him or herself at all.
Yeah. Just real quick, I will say I do support that product. I've seen it work for some dogs, so I think it's great. I've interviewed actually Julianne Lee was on our podcast a while back. We did a wonderful podcast with her, and she spoke quite a bit about just different things in general. So that might be something that might be helpful if you want to listen to that podcast. You can learn a little bit more about the founder who created that product. But for me personally, anytime I bring a product in, I actually use it on. I do this thing at the spa where I'll get a couple of clients because we see so many dogs, and I'll say, "Hey, have this product that I've been researching. Would you be interested in being a tester and see if we get results from your dog?" And so I did that with her product, one of her products. And it was a dog that boarded with me for 3 weeks and had chronic ear infections. And I put the dog on her yeasty beast protocol because the dog had been diagnosed with having yeast in his ear, and it worked. And so when I bring a product in, it's because I've personally, with my own eyes, watched it work and be beneficial. So that's when I support a product. So I will talk to the people, I'll learn about the product first, then I bring the product in, I use it, I find a couple of clients that might want to, let their dogs be my own little study and my own little experiment. And then I go from there. And so I do support that product. I think that it's a good product. So anyway, thank you so much. Can you tell our listeners, I know you said that you would do, and I know that Nilsa, who has Minky, who's 16-year-old Chihuahua, who is having the pancreatic problems, she's going to be contacting you. But for everybody else, can you let us know? Lori's going to type in for us real quick how they can get a hold of you, but could you just verbally tell everybody how they can get a hold of you?
Sure. You're more than welcome to go to my website. It is under construction, so please be patient. And that is www.holisticvetcare.com. And that's spelled with a W in the front. So that's OLISTIC vetcare.com. Or you're welcome to call my office directly at 352-796-2648. And I'd be delighted to help in any way I can. And I really thank Carrie for putting this information out there. I think it's incredibly, I want to empower people with their pets to be able to make educated decisions. Don't put pressure on yourself to try to become a vet, kind of in our shoes or whatever. But look for the right things and trust your instincts. And don't be too terribly critical, but be logical. Hear us out, and most of all, seek out a homeopathic veterinarian in most instances. And I know there are some that are really hardcore and less malleable, but for the most part, I think a lot of the homeopathic veterinarians are very compassionate, very empathetic. We be good listeners, or should, because it's
Yeah.
imperative to be a good homeopath to be a good listener. So seek one of us out as a partnership in the well care for your pet. And don't wait until you're at a terrible disease state. But for heaven's sakes, if you're in a terrible disease state with your pet, reach out to us, because we may end up not only saving you a lot of money in the long run, but we might even be able to help save your pet. Can't make guarantees of that, but doing that than allopathic medicine. And I can say that confidently because I am a DVM. And if allopathic medicine was working so well, I assure you I'd still be doing it.
I just love it. I love it. I love it. Because every DVM started out as a traditional veterinarian, and the
Correct.
ones who crossed over are the ones who got fed up with not curing and helping animals, and they looked for something else. Every single one of them that went to veterinary school started out traditional. So it's hard because a lot of
we took an
people
oath. We took an oath, above all, do no harm. And I
Yeah.
felt like in allopathic practice, I was doing regular harm.
Yeah.
And it wasn't on purpose. And I was frustrated. People would get upset because their pets didn't get better, or they got better and the problem came back again. And I had no answer for that. And I thought, well, there's got to be an answer for it. If we
Yeah.
stop asking questions, we're going to stop learning. And
Yep.
we as veterinarians have a responsibility to continue to learn. If you stop learning, we're just going to be stuck, dead, and doing the same old, same old, same old, and expecting a different outcome. And it's just not going to be there. The different
So
outcome is
true.
not going to happen.
So true.
Just isn't. So
All right, everybody, we're going to go ahead and wrap this up. Thank you again so much for being willing to come on. And it's late
my
where you
pleasure.
are. It's dark behind you.
Yes, it
And
is. It's gotten quite dark. Did everybody notice?
I know she's up late just to help you guys with this information. So please reach out to her if you need to do a consultation. Reach out to Dr. Cannizzaro. All of the information will be in our show notes, on our website, everything in order for you to get a hold of her. I know for my personal clients that come to me, you're always asking me for a good veterinarian. Here you go. I brought her to you. So this is
You're
who you
so
need to reach
sweet.
out to. So thank you. Thank you
Well,
so
I
much.
wish we were closer. It would be such a pleasure to have. I mean, to have an even, more physical, closer together kind of partnership would be wonderful. But I'll take the distance thing. And anytime we can educate people, it's just a gift that I'm happy to keep giving. So thank
Awesome.
you so much. I really appreciate you doing this and bringing
Absolutely.
us on, not just myself, but that are bringing incredible information and incredible empowerment to your audience. So thank you. I
Thank you.
appreciate
Thanks.
it. Thank you.
All right, Lori, thank you for behind the scenes. There's somebody behind the scenes, guys, who's typing out everything for you. So I want to also thank Lori for being able to do that for us. The reason I'm constantly looking down at my phone is because I'm reading your questions, so Dr. Cannizzaro doesn't have to, and also because I'm blind, so Lori has to text me your question so I can blow it up on my phone so I can read it. Because even with my glasses on the screen, I have to get close because of the way this is. So I'm not ignoring you when I'm looking.
I confess I have readers,
Even
but
with
I
my,
use
so
mine.
on this format that we use, it's Lori and I were talking about it. I said, we got to get a hold of them and tell them to do something. It's in such small print that even with my readers, I this. So Lori texts them. But anyway.
Oh, she's a saint. Thank you, Lori. You're amazing. Thank you. Thank you.
All right, everybody, have a wonderful evening, and we will see you soon. Thank you. Bye.
Thank
Good
you.
night,
Bye.
Dr. Cannizzaro.
Take care. Bye.